Okay, what we're looking at here is a little protrusion on Ben's shoulder, and it may not show that well on the video, but if you follow my finger, I'm right on the top of it now, and that protrusion is entirely based on a break that Ben incurred when his car got rolled by a wave up north. And so Ben, you went, you were airlifted out to hospital at one stage, weren't you?
Yeah, airlifted off the beach.
Yeah. And you went into hospital, and what did they do? I mean, you've got quite a badly broken collarbone there. When I saw you, I think it had been about a week since they had seen you, the so-called medical experts.
Yep.
And, you know, your back was in a real mess because it was all jammed up, all those muscles in the middle of the back.
Yep.
And what they just gave you some medication for pain, and that was it, was it?
Yep.
Yeah.
Pain relief.
Yeah. And so let's just talk about the little bit of Thai massage on the back. How did that feel when we sort of worked on the back?
That's awesome.
Yeah. Made a difference to the way you slept and
Yeah.
and the way you felt too, probably, or
Yeah.
just psychologically, just feel better when your back's not all jammed up and spasmed up, eh?
Yeah.
Got quite a sort of a clear look on your face today.
Yeah.
And let's talk about...
It's a bit twingy right now, if you...
It's starting to go that way, yeah. Well, I wouldn't expect a total kind of healing, but even just to get 24 hours
that would
out
be nice, a total healing.
Yeah, well, I mean, we can get there. It's just that, you know, when you've had it in a mesh like that for a week after something like that, it's not going to happen overnight. But I think, you know, certainly, you know, made some significant progress there. So just going back to that break on the collarbone, what sort of movement did you have, and what was the pain levels like before I put the devices on it?
Well, I couldn't really move the shoulder at all. I couldn't lift the arm up from the body. All I could move was the elbow.
Right.
And I've had it in a sling.
Right.
Like this for about a week or so.
Right.
Yesterday was the first time out of the sling, and then you did your little machines, and that gave me increased mobility. Like, I couldn't do this at the start of yesterday.
Right.
So it was...
You've still got that mobility 24 hours later, eh?
Yeah. So that's about as far up as I can go before it gets a bit twingy, and I can't really bring it much further that way. That's about as far that way as I can go. But I couldn't do that until after you did that machine. So
quite promising for just, I think it was about 3 6-minute treatments on average type of thing, wasn't it? Sort of thing. And which one do you feel made the most difference to it all?
Well, I guess that last one that you put on, because that probably gave the greatest amount of...
The one with the 2 pads, the APS, was it the 2 stick-on pads that were so hard to stick on because they were so old?
Though it might have been the combination of all three things. So.
I definitely know that after we did the acupuncture device, you definitely gave me some clear feedback that had made a difference, sort of thing as well. Yeah, so that's, I mean, you know, and that's just one treatment. We didn't do anything this morning, which we would have in the ideal world, and we didn't do anything tonight, which we would have in the ideal world, but we won't since I'm going up to watch the rugby. not exactly a totally new age guy. But it just shows you the promise that's there, you know, if you were to sort of use those things twice a day, which is the recommended, you know, when you've got an injury.
Yeah, I'd expect it to do wonders.
Move along quite fast.
Yeah.
And there's also the tonics. If you send me an email, which Bridget's got my email here, if you send me an email, I'll send you the feedback on the colostrum and the noni juice in terms of pain and injury healing. And between those tonics and using some of these devices while you're here, you should get that arm almost level with your shoulder, I think.
Yeah. I mean, felt great this morning. Got up and was like, still could move it. Felt heaps better. Back wasn't sore. It's a bit sore now. I've been walking around all day, but...
Oh, and that's great results for, you know, just what did we spend it on you, about sort of half an hour, 40 minutes or something like that, and that's after a week of being totally jammed up both on the back and on the shoulder, eh?
Yeah.
And isn't it interesting that, you know, you know that they'll airlift you out to this hospital where the supposed best medical minds in the country are,
full of morphine,
and all they give you is drugs. They don't, you know. Have you ever thought about whether they might have any knowledge of how to just loosen up a jammed up back? Do you think there's anybody in the hospital that might have the tiniest bit of knowledge on how to loosen up a jammed up back?
I'm sure they've got the knowledge. Just, you know, they're more important about filling in their forms correctly than actually helping out the actual patient. And it's the same with the aftercare too. Like, I went to see a doctor, and it was all about the forms and did I have my ACC number and stuff like this. And I got more help from you and from people here than actually going to the doctor. And
And isn't it interesting that, you know, that they don't have any of these technologies on hand, you know what I mean? Because all this time of getting you in the waiting room, I mean, that cost, like the cost to the taxpayer of you seeing them and getting nothing from them, that still is a cost to the taxpayer of probably somewhere around about $500. if I've got my figures right, an admission into outpatients and a couple of medical visits and stuff like that. And
helicopter.
Yeah, helicopter. Yeah,
20
yeah.
grand.
Yeah, well, probably needed the helicopter, but just in terms of care and research, getting you accelerated healing as fast as possible. I believe they're miles behind, and I believe they're not doing anything towards looking at pain and injury technologies, not doing any research on nutrient technologies, not using any of the standout physical therapies. And this is the deal that every patient that injures themselves in New Zealand gets when they go to ACC, when they go to a hospital, when they go to a doctor, this massive void in any kind of useful knowledge. And I just see myself as just an enthusiast, an average kind of guy with an interest in the whole thing, and I've learned a few little things along the way, but I've always had an interest in getting results. And you can just see the difference with somebody who's, when you actually see remedies that have been researched, applied, they work. It's just simple. Research works.
Cool.
Thanks, Ben.
You're welcome.